welcome to another exciting episode of Crosstalk. Today we are joined by Dr. Jyotsna Patel, a renowned gynecologist and obstetrician from Mumbai with over 3 decades of experience in women's health. She is a passionate advocate for breast cancer awareness, early detection, and empowering women to take charge of their health through knowledge and compassion. In this episode, we'll break myths, understand early signs, and discuss how awareness can truly save lives. Welcome, Dr. Jyotsna.
Thank you, Ekta, for inviting me. I'm
Thank
Dr. Jyotsna Patel, practicing gynecologist in Kripa Hospital, Andheri West, and Umang Hospital, Andheri East, since last 27 years.
Thank you so much for giving your time to us. I know you've been very, very busy. Starting with October is a breast cancer awareness month. Why is this awareness so important, especially for women's health today?
Breast cancer is one of the commonest cancer as far as gynecological cancers are concerned. 1 in 8 women is diagnosed with breast cancer. So you can see how prevalent it is. And the most beautiful thing, if at all, or the positive thing about this cancer is if it is detected early, action can be taken early, and the results are very good. There is 90% survival rate if it is diagnosed in stage 0 or stage 1. So that is why awareness is so important. Secondly, we have been noticing the changing trends in this cancer. Earlier, it was probably seen only in little later age, say 50 onwards or 40 to 50. But now you see it in young girls as well, and even in reproductive age group. So that is where again awareness becomes very important, so that women are aware how to do self-examination of breast. They themselves can detect probably the early stages.
Dr. Patel, you mentioned 1 in 8 women. So is it a global number?
Yes, it's a global thing.
Oh, and how do we detect it early? Like, how is it possible? Like,
So I think the most important thing is that the tool is in women's hand, and that is the self-examination. It's very easy to do, and if they are doing on regular basis, definitely it can be detected at an early stage.
can you share a little bit about how this self examination is done and how women should perform it?
Yes, of course. Now, self-examination can be done in sitting position, in lying down position, and I would say even when you're bathing. There is no dictum that it needs to be done probably like weekly or monthly. I would say why not every day? We look at our face every day. Why not our breasts? So very important is to inspect your breast. I always advocate my patients that whenever you have taken your shower, you come out, you should sit naked in front of mirror. Okay, look at your breast, inspect it, look at the size of your breast, whether both are normal size or one is bigger than the other, or there is any unusual change in size that you're noticing. Look at the skin, look at the nipples, whether there is any puckering in the skin, whether there is any dimpling, whether there is any rash on the skin. And look at your nipples. If the nipples are normal, they are outwards or they've got retracted. And is there any kind of rash or redness? So this is as far as inspection is concerned. You're inspecting your breast. Even while you're taking shower, when you're cleaning your body parts, you should move. When you move your hand over your breast, you can still detect things. Now, this is as far as inspection is concerned. Second comes the palpation part of self-examination. So what you have to do is that with the palm of your hand, not with fingers, because you try to touch your breast with your fingers, even normal glandular tissue will feel like lump. That's not the way it is done. So with the palm of your hand, start moving, press your breast, start from top, go circular, go on the side, go on the bottom, come back again on the medial side, and then come again on the top. And try to feel whether you feel any kind of elevation anywhere, any kind of lumpish feeling. Any doubt, visit your doctor. So this is as far as palpation goes. Then try to press your breast if there is any secretion that is coming out from the nipple. Usually there should be no secretion, but if there is any kind of bloody secretion, that can be alarming. That should alert you. That is squeezing the breast. Then comes checking your armpits. So palpate your armpits for any kind of lump. and then palpate your neck also for any kind of swelling or lump. So this involves the whole of palpation of your breast or self examination of breast to check for any abnormalities. So I would say every day when you're showering, feel your breast. If you have mirror in bathroom, look at your breast, inspect them, and palpate them whenever you have time. So it can be bi-weekly, it can be once in 15 days, it can be every day. If you're very busy, once a month is also fine. But the idea is you should know how your normal breast looks, then only you'll be able to know what is abnormal.
Thank you for sharing these, the examination tips. But lumps is something very common in our body.
Yes, I completely agree with you. So the thing is that every lump is not a cancer.
Yeah.
Okay. Having said that, I would still say if you find any kind of lump, there is no harm visiting a doctor and getting it confirmed. Most of the lumps in younger age group, if they are not in high risk categories, are fibroadenomas or fibroadenosis. These are benign conditions of the breast, which can be actually just requires counseling. And if it is bigger in size, then may require surgical intervention. But most of the time, counseling helps.
Okay.
So every lump is not a cancer.
Mhm.
But if there is a lump, please let your gynecologist or surgeon decide whether it's a benign one or something to worry about.
And talking about mammography, at what age women should get the mammography done and how frequently they should do it?
So, mammography is a screening tool, a very effective screening tool for breast cancer. And I would say, I would divide it into two categories: people who are at high risk and people who are not so high risk. Now, when we say high risk, means there is a family history of breast cancer, or if there is a family history of any genetic mutation that has happened, it has been detected, like BRCA1 or 2, they come in high risk categories, or women who have taken probably radiation for some reason, then those women come in high risk category. So non-high risk category, usually we advocate at the age of 40, mammography should be done, and it should be done maybe once in 2 years, that's fine. Can be done up to the age of 74 if the health is good, or even beyond that. So starting at 40, 74, or beyond that. This is non-high risk category. In high risk categories, sometimes we do advocate mammography even at the age of 30 and earliest at the age of 25 as well,
Oh.
and then it continues once a year till 74 years or beyond that.
Talking about radiation, what kind of radiation are you talking here about? Like the radiation we get from the mobiles, or is it a different radiation?
If the woman has had some kind of uh, you know um, uh, other thing where she has taken radiation, maybe some other kind of cancer where the radiation has been taken, then they become more prone.
Oh, okay, I get that. And what lifestyle or dietary habits you think can help reduce the risk of developing breast cancer?
So as I said that there are some changes that we are seeing, probably because of early detection, probably because now we have good screening tools as well.
Mhm.
But it's also been seen in younger age group. The reason why we are seeing is probably because of the lifestyle changes. Important in lifestyle, as my dictum is always diet, exercise, sleep, and stress. So, as far as diet is concerned, it's important that one consumes more of plant-based diet. Okay, avoid red meat, avoid foods which are fried, or simple carbohydrates or sugar. Go for more of complex carbohydrates, and maintain your body weight. Very important, because obesity again makes you more prone for cancer. Alcohol, I would say no, no. Some people say reduce it, because alcohol does bring about change in the DNA of a cell, and that can cause cancer. Smoking is a complete no, no. And if women want to use hormone replacement therapy, then that also needs to be done under medical guidance for a shorter period of time and low dose. So this is as far as diet and lifestyle is concerned. Exercise, again, very important. At least walking, jogging, yoga, Pilates, whatever you like, half an hour every day, you must do. Because exercise really, really helps in elevating your mood, removing stress from your life. And stress, poor sleep will bring about a lot of inflammation in your body, which
Yes.
again predisposes you for cancer.
So on the whole, all good habits bring everything good in your body, in your lifestyle, and that really helps. A breast cancer can diagnosis can be emotionally devastating. What advice do you give to patients to help them cope up mentally and emotionally?
Yes, very true. I think it can be very devastating for a woman to know um, that she is having breast cancer, and most of these women, we do refer to psychologists for psychological counseling.
Okay.
First and foremost is acceptance. Okay, there is always a question: why me? I have been taking care of my body, I have been exercising everything, because no one is immune, you
Yeah.
see. And so acceptance is something which is the first step of this disease. And then once the acceptance is there, how to bring about changes in your mindset. So very important, whatever emotions you're going through, okay, you need to discuss it, you need to open up with it, either with your family members, your either very close friends, or even psychologist. Make a journal, write down about your what you're thinking, because once you take it out, it's cathartic. And that is one thing. Second is, you don't have to go through it alone. Okay, you, if you have good close friends or family members, take support of them. Okay, discuss with them, open up with them whatever you're feeling, whatever you want to talk about, so that you become more positive. Thirdly, I always, once all these steps are taken care of, then what is in your control? Okay, in your control now is again taking care of your health. So
Yes,
what you
absolutely.
should be eating, what you should be, how you should be exercising, how much time you should be spending with your family, with your kids, and recreation, because this will bring about little control. If you have a group in your community, if you have a breast support system, breast cancer support system, then you should join that community. So this is how we counsel the patient. And every visit when the patient comes, we need to spend more time with them counseling rather than actually treating. So what they need is tender, loving care. We call it TLC.
Oh, that's so nice. Uh, one question that just popped up in my head. In today's time, I mean, I remember maybe 25 years back when my friend's mother had cancer and her breast was removed. So in today's time also, do they remove the breast or they just remove the part of that infected
So
tumor
again,
cancer?
here again, I think very important is early detection.
Okay.
Once cancer is detected early, there is also a treatment where only lumpectomy is done. That means only that lump is removed, and then depending upon what type of cancer it is, if the patient requires chemo or radiation, we go about doing that. So not every breast cancer probably will need mastectomy, radical mastectomy, removing of the breast. Nowadays, we do lumpectomy as well, especially because it's seen more commonly in younger women who still have to, probably complete their family, and they're young. I mean, removing a breast can be very traumatic.
Yeah.
So if we feel that it's not a very virulent type of cancer or something which is aggressive type, then lumpectomy is also an option that is kept in mind.
Okay. And in case if the breast is removed, they can go in for that cosmetic or that surgery procedure again after that?
Yes, yes, of course. So once the mastectomy is done, and whatever we want to do further treatment, what type of cancer it is, whether radiation and everything is required, we do advocate they can go for breast augmentation.
Oh, that's nice. One last question. Uh, how much time does it take to heal up, like for a breast cancer person? And
So usually when mastectomy is done, it is called a radical mastectomy. That means the whole of breast is removed. There are lymph nodes which are removed from the armpits, and it's a supramajor surgery which is done by in combination with gynec surgeons and oncosurgeons. All right, and the hospital stay is somewhere around 7 days to 10 days. Okay, and then the patient is again reviewed after maybe 15-20 days, Depending upon what type of cancer it is, chemotherapy is started. So patient can resume work maybe after a month or so, but she'll have to come to hospital for her chemo cycles, which may be sometimes 3, sometimes 6, depending upon what type of cancer it is.
Oh, Dr. Patel, it has been an absolute pleasure having you on the show. Thank you for your commitment to women's wellness and for guiding us with your wisdom and experience. Ladies, please start taking care of yourself. Early detection, early cure. With this, I end up today's episode. Thank you very much and enjoy the
Thank
rest
you
of
so
your
much.
day.
Thank you, Ekta. Thank you.